righty, let's go ahead and start. Good afternoon, everybody. Thank you so much for taking the time of your busy schedule to attend today's Guaranteed Trust Life training. My name is Andy Rivera. For those of you that don't know me, I'm one of the regional sales directors for Pinnacle Financial Services. I'm located down here in sunny Miami, locally away from the cold weather. With us today, we have Dimitri, the Assistant Vice President of Sales for Guaranteed Trust Life. He's going to be informing us of his short-term home healthcare insurance product. And Dimitri, take it away.
All right, thanks, Andy. Appreciate it. Good afternoon, everyone. Like Andy said, I'm Dimitri Simos. I've been here with GTL now going on over 20 years, and I think short-term home healthcare is one of those products and or parts of our pillars of being able to provide some support to your clients that probably doesn't get talked about enough. So hopefully after today, this would be something we can make it easy for you to talk with your clients about and be able to have them get this great coverage. That really works to really will be in their benefit for sure. So we'll get started, and first off, we'll get started talking about GTL. In case those of you are not familiar with Guaranteed Trust Life Insurance Company, that's our full legal name. Like everybody knows us as GTL though. We're a family-run business that's headquartered out of Glenview, Illinois. Our domicile company, our domicile corporation though, is based out of Omaha, Nebraska. Well, we were founded in Chicago, Illinois in 1936. We moved out to Glenview in 1982, and that is our picture of our home office. That's in Glenview. It doesn't look that pretty today as it does when the picture was taken. Unlike Andy, where he's at sunny and warm Miami, I'm in Chicago, and we're getting snow and it's chilly. So, it's quite the contrast between our two worlds, Andy. That's for sure. But I'm not complaining. We're used to it here in Chicago. But when you look at our building there, we have about 300 employees that work at GTL here, and they all work out of the home office here in Glenview. And when people ask me about, what is it about GTL that, why as a mid-sized carrier, are you guys, successful? And it really comes down to the people that work in the building. We have a good mix of talent in the building. Fortunately, our mix has a long tenure also, which provides great service for your clients when they're calling into customer service, or for yourselves when you're calling into our sales support folks, or folks that are taking care of paying commissions and such. You got folks that are coming into the building, but then folks that have been around and can definitely help and take care of things pretty quickly for yourselves, your clients, and so forth. So I think that's a pretty big piece of it all about why people like to do business with GTL. We are licensed in 49 states. The only state we don't do business in whatsoever is going to be New York. We handle life and health products. The health products won't be in every single state that we're licensed in, and we'll have life products that are going to be in every state that we're licensed in. So, excuse me. It's definitely something I'll show you how you can take a peek at what's available in what's particular state that you may be working in as a resident state or even a non-resident perspective. This next slide here is going to just show you where we have short-term home health care available in today. So we have a pretty broad list here of where short-term home health care is available today. They're all the states that are highlighted are going to be our newest version of our home health care, which that's what I'm going to go over with today. As you can see, Kansas was the only state that doesn't have a highlight as of now, but hopefully we can get that changed at some point in the future here. But we've got a lot of opportunity, nice footprint of of product availability from a short-term home healthcare perspective. When I think about short-term home healthcare, I know probably a lot of you know GTL because of another famous product of ours that we came out with 20 years ago, our hospital indemnity plan, the Advantage Plus Elite. It's a great product for MA. I want you, as we're talking about short-term home healthcare, think about short-term home healthcare for your Medicare clients, either being a Med Sub client or even an MA client. Both sides of the spectrum of Medicare, will definitely have a need for short-term home healthcare benefits for your clients. Because the one thing I will I can safely say is that Medicare in general, from the plan itself, if you were just talking to a client in general, some of the things to kind of consider is the client taking prescription drugs? Has the client not planned for their future care? We probably know that answer is probably quite a bit did not. Did your client talk to somebody about LTC? But as unfortunately the story goes, you talk about LTC, but you find out you have health circumstances that you can't, that you can't qualify for LTC, or if you could qualify for LTC, traditional LTC that is, that it's too expensive. So is this going to replace LTC? No, it does not replace traditional LTC. Is this another option that be able to provide some benefits for LTC, like LTC does? We'll do that for for the client. Then, and as long as they're not already receiving any kind of home health care and they can perform their ADLs, you're going to be very happy that you're going to talk to them about home health care today. So I'm going to share with you next a video that's consumer facing that you're going to be able to share with your clients, or even use it. Let's say if you have a website, you can put on your website, or if you want to use the video as an email campaign and have your clients click on it and watch the video, then to reach out to you, or you can use it during your point of sale conversation with the with the insured, so they kind of get a really good idea of what the plan is that you're going to talk to them about. It's a short video, about 2 minutes, and I think it does a really good job of explaining the product.
And if you suffer an illness or have an accident, the last thing you would want to do is recover in an unfamiliar, hectic environment like a hospital or nursing home. Focus on your recovery in the comfort of your own home with short-term home health care insurance from Guaranteed Trust Life Insurance Company, reminding you they don't want to go to a nursing home. How could being unprepared for either yours or your parents' need for care affect your finances and way of life? GTL's short-term home health care insurance is more affordable to host on a plan of care policies, and it pays benefits directly to you regardless of any other insurance you have. Home health care benefits kick in if you suffer a cognitive disability or can't perform 2 of the 6 ADLs. Well, hospital stay is required. The base plan consists of 3 main components, and there are 3 different base plans for you to choose from to match the level of coverage you want. With the home health care benefit, your chosen plan pays a benefit for up to 360 payments for a variety of services, including skilled nursing, physical therapy, and general nursing care. With our most comprehensive plan, you can receive up to $162,000 of home health care benefits. With the home health care aid benefit, you can receive a daily benefit for each day you require the services of a home health care aid, depending on your chosen plan. No hospitalization stay is required. Most likely, you're taking at least 1 prescription medication. With the prescription drug benefit, you receive benefits for any prescriptions that are filled after the policy is in effect. Just filling your normal prescriptions can help offset the cost of the policy itself. Now let's see how it works. Say you're 65 years old, have the Plan A policy, and take 1 brand name prescription that you refill 12 times a week. GTL's short-term home health care insurance would pay you a total benefit amount of $300 over those 12 months, with an annual policy premium of $365.68. The net cost of the policy would be less than $6 a month. And this is not even including any home health care benefits you may receive. Policyholders also have access to TCare's concierge caregiver support services and a $3,500 family caregiver benefit. Short-term home health care insurance from GTL is flexible, customizable, with a great set of riders for you to choose from. And with only 2 or 3 underwriting questions, you don't have to worry about a long application process or medical exams. So, for a fair premium, wouldn't you rather receive professional care at home? Now is a great time to find out more about GTL's short-term home health care insurance.
All right, that's the video that you're going to have access to, and I'll show you where you can access this video when we're done with actual, PowerPoint part of this all, just so you have knowledge of that. But I'm going to put the cart before the horse here, and I'm going to talk underwriting first. These are the underwriting questions. This plan, it's really that simple. As you see at the bottom of the slide there, no MIB, no phone interview, no medical, no RX, or anything like that. It's straight off the application. If a client's looking to buy, we have, as you'll see when we go through the plan, we'll have 3 plan options. If they look to purchase the plan A or plan B, all they have to answer is the first 3 questions. If they look to get the option C, plan C, then they'd have to answer the 4th question. As I'm sure, as I've been talking, you guys have been reading these questions, and you probably are thinking to yourselves, I got a ton of people I can talk to about this that will qualify for this. Now, Dimitri, be quiet about this and tell me about the plan, I'm sure. So I'm going to do that. I'll move on so you guys can see what the plan's all about here. This is what our base plan looks like, okay? The base plans are going to be 3 plan options. It's going to have prescription drug benefit in it. That's what the base product looks like in total, okay? The issue ages currently are going to be ages 61 to age 85. So that's something important to know. And the maximum benefit period for plans A, B, and C is a 360-day benefit period, which is why we can call it a short-term care product. If it's longer than 360 days, then it falls into the long-term care world. So we can't have it longer than that. One thing I will say, and I'll probably say it again, the maximum benefit period is not based on a calendar year. So if it takes somebody 2 years of 3 times a week of getting home health care, and it takes 2 years over, from a calendar perspective to eat up the benefit period, not a problem, okay? Again, part of the plan is going to be the prescription drug benefit. I think it's a very important piece of the plan because, as the video showed you, the person gets money back for getting scripts filled. Now, questions I always get about this is going to be, well, do the scripts have to start after the policy's been issued? This is the only part of our plan on the home healthcare product that does not have pre-existing condition language associated with it. So if a client has been taking a prescription med for years, and then you sell them a short-term home healthcare product, and then the next time they fill a script with that, whatever it was, that automatically qualifies, okay? And we'll go through what that means, and what that means is $10 they'll receive for every script that's filled for generic scripts, and $25 for each brand name. Now, if the person chooses plan A, they'll be able to receive up to $300 per year. If it's plan B, up to $600 per year, plan C, up to $900 per year, okay? Again, very important to state again, because I know this is always the one that people don't believe me, there is no pre-X on this prescription drug portion of this. So if they've been taking XYZ med, for 5 years before you met them, and they get this, that's going to be covered. There'll be a benefit payable to them once the policy's in force. So as the video showed, this is a good opportunity for when you're looking at the plan, when you're looking at a home healthcare plan here, that at age 65, you're going to look at getting back, full benefits. If it's 12 generic, 12 brand name, or if it's 30 generic scripts filled in a given year, as long as they get to that $300 mark, they're going to be able to net cost the cost of this policy with that $300. So at age 65, if plan A is at $365 until the annual maximum benefit is reached, that's the key there, okay? Now this is another important question. 3-month supply, how do we treat that? Do we treat that as 3 scripts that are filled for a 3-month supply, or is it 1 script that's filled? That's the question, right? Well, here's the answer. We treat the 3-month supply as 1 script that's being filled. If the client wants to take advantage of getting a script, of getting their benefit on a monthly basis, they have to break down that 3-month supply to a monthly script fill to be able to get the benefit for that. So now, does it matter what kind of copays, or if there are already copays at all with their scripts? It doesn't matter whatsoever. If they have a $0 copay, if they have a $8, $10, $20, whatever the number may be, doesn't matter. They get a script filled, they're getting $10 for generic or $25 for brand name, period. Very simple. All right, let's talk about the base benefits, because this is, I think this is pretty important also. When you look at the base benefits, as we mentioned, there's 3 plan options, plans A through A, B, C. Now, in order for somebody to get a benefit from the home healthcare portion of this, they're going to need to not be, and then provide a plan of care for home healthcare. Now, if a client were to say, let's say the client has is going to build in there a visit, for skilled nursing, Plan A will go up to a maximum of $150 per day. Plan B will go up to $300. Plan C will go up to $450. So my recommendation, I'll say this again down the road here, make sure the client maximizes the daily benefit that they receive each day, because that if they don't use the full 150, 300, or 450 in their benefit, it doesn't carry over, to another day or to a future date. So they need to definitely use that. So I always tell people, do skilled nursing and do physical therapy the same day, so you can get that $150 for that, or try to get as much of it as possible in your on a per day basis. Okay. And by the way, if you do have any questions along the way, I will say, please put them in your chat, and we'll take a look at the chat or the Q&A box on the GoToMeeting here, and this way I can answer that for you. Again, the maximum benefit period is 360 days. Again, nothing to do with the calendar year. It's just how long it will take to get them, have a person exhaust that 360-day benefit period. And then benefits would restore if they've not been paid or services required for 180 consecutive days. Now, as you're looking at the plan prior to these boxes coming up to the screen, you're probably going, 150, 70, per day. You got $75 benefits, $100 benefits. All those things will add up. So if a person would maximize out their benefit per day for the full 360 days, on a plan A, they can get up to $54,000 of benefit, which is substantial. I mean, we talked about plan A at age 65 was $365 a year for cost, right? To get access to $54,000. That's right in line to what we do in our business, and what we do for our clients is take pennies on the dollar to be able to access a significant. Plan C, $450 times 360, $162,000. Talking really, really substantial benefits here, guys. Your clients will not be mad at you whatsoever for having a conversation about taking care of home health care for them. Okay. Now, home health care aid does fall into this box here. Okay. That's something that's always been a question over the years. We've had this plan out on the market now. Geez, we're going on 8 years, I believe now. And home health care aid is always the conversation piece that we talk about. That's a 360-day benefit period, even with a home health aid. So that's part of the 150, part of the 300, part of the 450. So if someone's got a home health aid coming in, it's $50 for plan A, 100 for plan B, 150 for plan C.
Okay. So we have somebody asking if it's not available in Connecticut.
No, probably not. I don't think it is. We do have a nursing home policy in Connecticut that does allow for home health care benefits. So you may want to look at that in Connecticut.
Okay. Another person's asking if it's available in Florida.
Not in Florida.
Okay. Does the prescription drug kick off the benefit period?
No, it's a separate benefit pool. The prescription drug benefit's separate than the home healthcare benefit that you see on the screen right now. That's a totally completely different buckets of dollars.
Okay. Another person asked, so you're not supporting New York or New Jersey?
We do not have product available in New York for sure, because we don't ever do business in New York, and New Jersey does not approve these plans. So no. Unfortunately.
Those are it for now.
If I had New Jersey, I'd have my mother-in-law on this plan, that's for sure. So
All right, you can keep going down. There's no more questions.
Okay, great. So this is an example here. Nothing too fancy. If somebody were to have a plan A and have, like I mentioned, try to pair them up on to get per day. Let's say physical therapy, speech pathology, that's 150, and they had 10 days worth of benefit period, they'd receive $1,500. And still their annual premium for that 65-year-old scenario was $365. Which is definitely, I think we all would agree, I'd rather pay $365 to get access to $54,000 or maybe $40,000 than have to pay that straight out of my pocket, the $1,500 or $10,000, whatever it's going to end up being down the road. I talked a little about the home health care aid. We used to have this used to be a separate benefit with a lesser benefit period, but when we adjusted this product a year or so ago, we did increase the home health care aid benefits and put it as part of the 360-day benefit period. So it definitely, it's definitely a really, really good benefit and something that a lot of folks will definitely be using for sure. This is part of the base plan. And, so if somebody were to just, would use the home health care aid benefit, this is what the total dollar amounts could amount to just from a home health care aid perspective. $18,000, $36,000 on Plan B. Plan C is $54,000. So it could be substantial. So if they incorporate home health with another service to max out that 150, 300, or 450, that's part of the total number that I showed you earlier about what plans A, B, and C can do. And it's still, it could be a lot of dollars going to clients utilizing this. So who can provide skilled and aid? Okay, that's always a good question to ask and try to answer here. For a skilled care perspective, that has to be a registered and certified nurse or agency of that's licensed in the state to provide the skilled care. Okay, and then for the aid perspective, they have to work for a licensed agency that can provide and bill the services for the detail of each service of each visit that's provided to the insured. That's it. Okay, so basically to kind of make it simple, as long as the client is utilizing an agency that's licensed in the state, and they can provide a bill with the details about the skilled side and the home health side, that's all we would need to be able, along with a plan of care at the time of claim, but we need to be able to take care of that and get the claim adjudicated for you. Now you probably saw on the video a T-care or caregiver benefit, and that's what we call T-care here. T-care is it's a benefit that provides a lump sum amount and some support for a family caregiver. So they don't have to be part of an agency and licensed in the state and so forth. This could be someone's spouse, child, relative, friend that's just there to help, that's just helping them just out of the kindness of their heart, right? Because they love the person. A lot of times what happens with caregivers, and I'm going to show you a video that's probably talk about this much better than I can. A lot of times with caregivers, they're busy doing their thing too. They got their families, they got their life to take care of, and they're fitting in to help out their loved one. There's a lot of stress involved, and there's no support there for caregivers. So what T-Cares can do for them is provide them resources to help them manage the stress. And then on top of that, there would be once they go through the T-Care assessments and such, then a benefit would be payable, that could be given to the caregiver. Okay. Excuse me. One thing I will say about the caregiver benefit of the $3,500, if you pay the caregiver benefit directly to the family caregiver, that would be a taxable event for that person. But if that benefit gets paid to the insured of the policy, then that is a non-taxable event, and then the insured can do whatever they want with that money. Pass it over to the caregiver or pay bills, whatever the case may be. It's up to them, up to you guys there.
CEO of T-Care. About 7 years ago, my wife and I were caregivers to my mother-in-law that was diagnosed with stage 4 lymphoma cancer. We became aware of this term known as family caregiving. As a former naval aviator, I was trained to navigate myself through extremely hard, difficult situations. Caregiving was one that I found myself lost in. T-Care was born as a solution to help family caregivers navigate all the challenges that they go through when they are taking care of a loved one. we are born out of a academic research project that through 7 years of 2 sets of clinical trials, over 15 years of longitudinal data, led to our understanding for families what solutions at what time, what place are the most effective. My wife and I thought respite or home care services in our caregiving journey. But when we went through the T-Care algorithms, the process, what the system identified was that we needed marriage counseling because our risk factor to burnout was a toll that caregiving was bringing on our marriage. And that's what had led us to start thinking about placing my mother-in-law into an institutional facility. And so the process of what T-Care works is we engage families, whether the policyholder and the family caregiver, the primary family caregiver, typically spouse, daughter, son. The process to use T-Care is extremely easy. It takes 90 seconds on a web portal or a platform to fill out a form. And through that, one of our social workers and our T-Care specialists connects with those families. And through a 25 to 35-minute consultation process, they help them navigate all the resources that they need at any given point in time. To receive the T-Care family caregiver support services, it is extremely simple. Either a phone call or a text message away from families. There's no claims process. There's no adjudication. Families can have access to the T-Care benefit starting day one of owning the policy. T-Care is here for you and your
Dimitri, some people are complaining that they can barely hear the video.
family support system.
Oh, okay.
So that families don't ever have to be challenged with the burden of caregiving, so that they are spending more quality time with
All right. Okay. So that kind of gives you an idea. I'll show you where you can definitely hear the T-Care message when you're for yourselves too. Sorry if that didn't come through well. So again, T-Care, $3,500. You go through an assessment. The client will go. The caregiver goes through an assessment and get some support to help them, cope with any stresses, and that can help to help them. That's the important thing here, right? All right. So there we go. All right. So as I mentioned at the beginning, pre-existing condition language, right? The pre-existing condition language encompasses the whole policy with the exception of prescription drugs. So let's make sure we remember that part. Prescription drugs, no pre-X, but the rest of the policy, there is pre-X. It's typically a 6-month pre-X. So if they were treated by a doctor for something within 6 months of the policy being issued or in force, and then that person receives a diagnosis for home health care, let's say, within 6 months of the policy being in force, that's not a covered claim until after 6 months of the policy. So that's just a kind of quick synopsis there about pre-X. Make sure we definitely talk about this, with the clients. I want to make that, definitely want the clients to understand and make sure that what the pre-X language is. It's not, it's definitely important. All right, so now the way that the pricing works on this product is that the home healthcare aspect of it is going to be attained age pricing, okay? The T-Care benefit is going to be an issue age cost associated. So that part of the cost for T-Care stays the same from when the client, at the age of the client purchases the product. But the next slide here will show you what it looks like for somebody that's on a plan A, B, or C. If they're between age 65 and 70, it's going to be $22.87 a month for the home health care and prescription drug benefit. And then once they hit age 71, it'll go up to $31 a month. When they go up to 76, it'll go up to $41. At 81, it'll go up to 55, and then there'll be one last time that it goes up at age 86. Okay, so that's that part of it. Now the T-Care part here, if the person was 65, it'd be $22 and some change plus $594, and that'd be their monthly premium up until their age 71. And then when they hit 71, the home health care part's going to increase, but the T-Care part will stay the same at $594. Okay. So just want to make sure, and then don't, and when you're trying to do this by hand, make sure you do, add on the policy fee, the monthly policy fee of $1.67 there. Now there's going to be riders on this plan that's going to be, that's you're going to have access to. Okay, we have a hospital indemnity rider. So those of you that are familiar with GTL, and we have a great hospital indemnity plan, and it's outside of the guarantee issue window maybe, and you're looking to try to maybe get a little hospital indemnity benefit for your client, this could be an option for you because of this simple, super simple underwriting that the home healthcare plan has. You can maybe look at, doing $100 a day for 3 or 6 days for plan A, plan B up to $200, plan C up to $300. Now the big difference between this hospital indemnity rider and our regular hospital indemnity plan is this will be an attained age pricing on this hospital indemnity rider. So this will go up also, as it will go up also according to their, what their current age would be. So it's not going to be the same as our hospital indemnity, but conceptually it's you get some hospitalization benefits there for your clients. Okay, so we'll be attained age pricing. There's a 30-day wait for sickness of hospitalization benefits to start. And then there's, again, the 6-month pre-X. Some other riders that you have options to. Now, if you write other plans of GTL and you already put an ambulance rider on there, you can only use one rider for each person. You can't do it for, it's not per policy. It's, if somebody has an ambulance rider, it's one ambulance rider per person, even if they have 4 different types of GTL products with us. We have a critical accident rider. Critical accident rider, I love this rider. I jokingly call this a senior market rider. And the reason why I call this a senior market rider is because this is the type of things that we hear about that happens in the senior market with the seniors a lot, right? And so what it is, it's an accidental death plan, a $5,000 or $10,000 benefit. So if the person passed due to an accident, the beneficiary received $5,000 or $10,000. But as we're getting older, probably a lot of accidents aren't going to probably be what's will be the end of what causes the end. But along the way, you might get a hip or skull fracture. So you can get a benefit. If you had a $10,000 plan, you can get a $2,500 benefit paid out, and then just reduces the accidental death benefit amount by the amount of benefit that was paid. So I broke my hip, I get paid $2,500, my accidental death benefit goes down to $7,500. And then down the road, let's just do it for easy math. I had a knee dislocation. I get paid $1,000, brings down my death benefit down to $6,500. If I now break a bone, I get $500, reduce it down, another $500. I can take it down all the way down to zero. Okay, these riders here, the ambulance rider, critical accident rider, these riders will be priced at an issue age basis, okay? So that's important there. And then there is a return of premium option also for those folks that say, well, what if I never use a plan? Well, you can put a return of premium option on there for them so that they can, get money back if they don't use a plan. Now, how to file a claim? Super easy. For the drug part of it, this is probably the first question everybody asks is, well, how do I get the claim filed for the prescription drugs? All we need is the label that's provided by the pharmacy, not the cash register label, the one that they staple on to the bag that has all the highlights on there. And it talks about what is it, what is the script, and then let's just send that in. That's all we need. Maybe if there's a cover letter on there to say who you are, but who the insured is, and a policy number, that'd be helpful. That'd be great. Okay, and they can send us in on a monthly basis, quarterly, semi-annual, or annual basis. The home healthcare side, we just need to have if we wanted to get benefits paid out of the A, B, and C side, or a home health aid, they would just need to complete a claim form, include a plan of care from the physician, the proof of service, again, licensed agency. They'll send them a detailed information on what services are provided when, and then submit that, and then with the submit that in, and we'll get that adjudicated for the client at that point. And then all the other riders, as the situations occur, that's when you can send those in with the appropriate supporting documents in terms of that, what the service was and so forth, to be able to get a claim paid for the client there. Now, e-app wise, we have a new thing that we've been using, text to sign, which I got to change this slide. I apologize. I just realized I have an old slide on this, but we just changed our text to sign option to actually be a text pin. So what happens is if you want to do our text to sign option, what happens when you send the client the text is they'll get a code, and the client will need to read that code off to you, and then you input the code on the screen, and then you hit verify, and then it lets you go through to the next page to be able to submit an application. So this would be a good time right here to kind of switch over real quick to our website, where to kind of show you some things that could be beneficial for you, so forth. But this is without even logging in. Okay, so you can go to customer service, file a claim, and our claim forms will be listed. It will be right there as a PDF. Your clients can come here and print these off. You can come here, save them, send them to your clients. Your clients can call customer service. We'll send them a claim form kit so they can fill out the forms. But as you see, short-term home health care is right there. So you can print it off. Very simple to do. We had questions about product availability earlier. State approvals. Well, what state are you curious about? Well, let's take a look at Jersey, right? Well, unfortunately, I don't have it in Jersey, but I have it in Illinois, I have it in Georgia, I have it in Alabama, I have it in South Carolina, I have it in a number of different states, all over the place. So click on the state, so it might not be in your resident state, but if you do non-resident business, definitely check out your states that you have a non-resident and see if it's available in those states. All right, so now for those of you that are currently contracted with GTL and you have a writing code number, great, and this next part will be easy for you. For those that aren't currently contracted with GTL, please reach out to Pinnacle Financial and they'll get you contracted. It's a very easy, short process. Probably takes about 3 to 5 days to get the contracting done once we receive it, and then you'll get a welcome email from us with a writing code number, and then you can come right here to where it says agent login. And those of you that already have done this, you know what to do here. Put in your username. But those of you that are first time logging into our e-app, you just click on new user, register now, input your writing number that we gave you, and then you fill out the rest with some personal information that you know, and then create your username and password. And then right away, once you have that confirm that it's accepted, you come straight to right back here right away, and input your username and password, and get right into the system and have some fun with this. Now, keep in mind, when you log in, this is live. So don't submit any apps unless you're really ready to submit apps. But some of the first place I want to take you to so you can take look is Access GT link. You're gonna see where it says consumer marketing. You're gonna want to click on short-term home health care with the new T-Care if it's available in your state, or if you have short-term home health care in your Colorado, Indiana, Kansas, Montana, PA, Rhode Island, or Tennessee, you need to use that. You look at that one because it won't have the T-Care in those states yet. They're working on it, but we haven't gotten there yet. And then the consumer product video that I mentioned earlier that you can access, you come right here, click on it, and you can watch the consumer product video right here. And or you can also come right here and copy this link right here, you hit copy, and then now if you created an email or if you have a website, you can copy and paste that link into the email or a website, or even on Facebook, or if you have a business page that you have on Facebook, put it on there and say, hey, call me if you're interested to talk about this, and paste it right in there, and people can watch this video. I think hopefully you agree that the video was very very informative. I know we've gotten a lot of feedback that agents use this video and they say straight after the video, they say, okay, where do I sign up? So I think it does a really good job from that perspective. So from a short-term healthcare perspective, this is where the product video is. I think it's definitely a very good help for you. Whenever you see these 3 bars in our e-app or even on our GT link here, because if you notice it came up as a new tab here, you want to use this to navigate around. If you want to download forms like for brochures, apps, if you're still doing face-to-face, great, not a problem. You can do that right here, and we'll submit the order electronically. If you want to do trainings for other products, you come up here and click on whatever you want to see. It's all pre-recorded full webinars for various products. And then let's go back to this. Then right here, we got this right here, quote and submit. Right, it's so simple to do a quote with our electronically with our short-term home health care. That all you got to do is make sure you click on mail, put in a date of birth. We'll just use 1956. And we'll just say I'm using Illinois here. I hit next. Then I'll click on short-term home health care. Select the plan option. By the way, the average plan that we do get is an option B. If you want to add ambulance rider, if you want to just keep it straight, just home health care and that's it. The cost for this person at age 69 for plan B would be $55.42. You're probably going, well, wait, Dimitri, you told me it was only $365, 20 some odd dollars a month. Well, if you take the $55 and I change it to annual here, it's $664 annually. But remember, this is plan B. So that means on the prescription drug side, I get $600 back for all the scripts that are filled and so forth. So now my net cost of insurance is still going to be $64 a year. Okay, but this is the average. If you want to go plan A, not a problem. Take a look at it. It will adjust here in a second. There it is. That's the annualized premium in Illinois for plan A. So it's at $90 a year net cost if you're using the full $300 prescription drug benefit. So then once you've determined that's a plan you want to go with, you click on apply, and then you go ahead through the application, and then you get to choose to do a text to sign where the client will get the code, and then you input that in, or you can do a voice verification call where the client, where you call the third-party line, and you sit on the phone quietly, and you can coach the client to say that they're going to ask you your name, your date of birth, your social, what's my name as the agent, what's the product, short-term home health care, did you answer the questions truthfully, and do you know that there's a premium associated with this sale? And if they answer when they answer those questions, they'll say thank you for the call being verified, and then you can go ahead and finish off and submit the application. Now, we do have another platform. So if you are a face-to-face agent and you like e-apps, I would encourage you to go to the Google Play Store or the Apple Store and search GTL e-app. You'll see a turquoise colored logo that says GTL in it, and that's going to be pretty much exactly the same as what our website version is here, but the big difference on the mobile app is that you're taking the application on your iPad, your phone, or something like that, and the client can sign the application right there in front of you, right on the device. Use a stylus, their finger to sign their name, and then you can submit an application directly from that mobile device. So if you're face-to-face, mobile app is a great option. If you're doing telephonic sales, the website version here is the best option to go with on that. But I know there's a lot of information that we went through here in the last, the last half hour, 40 minutes or so, whatever it's been. But if you do have any questions, we're here Monday through Thursday from 7 a.m. to 5 p.m. Central Time, or 8 to 6 Eastern. And on Fridays, we're here from 8 to 12 Central Time, or 9 to 1 Eastern. And you can reach our sales support folks at 800-323-6907. And you can, by chance, always also text that number if you'd like, and they'll respond to your question via text back. And then my email address is listed right there at dcimo@gtlic.com. I appreciate you guys taking the time today. I think I see the chat box flashing, so I'm sure there'll be a couple of questions, but I appreciate the time, and hopefully you guys find this as simple as simple to work with as I've kind of shown it to be. So with that, I'll see what questions we got there, Andy.
All righty, let's go ahead and take a look here. Give me 1 second. It's not opening the box for me.
It must be the snow up here that's blocking your system, man.
I got it here. There we go.
All right.
Take a look. All righty, so if beneficiary has no meds, then the cost is the gross premium, not the net, correct?
Correct. Yes, it would be the gross premium. If there's no meds, it's 365 or whatever that number is. It's just the offset with the meds is what creates the net scenario.
Someone asked to please talk about ordering supplies.
Oh, sure. When we went out to our, you know what, I can go back out there real quick since I'm still sharing. So when we go to our initial, when we go right here to GT Link, if you go to download order forms, you click on your particular state. Let's say I'll just use Illinois and then I'll scroll down to where I'll see home health care short term, depending on which one I'm looking for. If I have the new T-Care benefit in the state that I'm in, I'll click on the information for short term home health care or T-Care. And then I'll click off to the side just to kind of get that box away. Then I'll click on search. Then right here, I can say I want 15 brochures. And let's say I want to get 15 applications. Just got to find where the application is. There it is. 15 applications, and maybe I want to have a couple of basic rate sheets with the underwriting guide just so I have it handy on me, right? Or I can download that and save it on my desktop, whatever I want to do. So then I hit update cart. I forgot to hit update cart. So now by updating cart, I put in my cart here. I click come to my cart. I review my order, make sure that's what I want. I hit continue. And then the information that you provide to us during contracting is, will pop up right here. And you can do, so then you confirm that's what you want it to be delivered to, submit order, it'll transmit electronically to us, and then you'll get, and then within a few days, you'll get a supplies. But all this could be downloadable for you also. Doesn't all have to be done, doesn't all have to be, you can download it here, then save it to your computer if you like. So a couple of different options here.
All right, next question would be if this is available in Nevada.
Good question. I don't remember, but I will tell you in a second. Let's see how good I am with geography here. Nevada. Short-term home health care with T-Care. So you guys in Nevada do get the home health care caregiver benefit.
Another one is if GTL has hospital indemnity product in New York or New Jersey.
In New Jersey, we do have our Advantage Plus product is available in New Jersey. New Jersey has an interesting rule, which it's a maximum of $250 of daily benefit for a 31-day benefit period, and that's all it has. But you do have access to it in New Jersey, though. New York, no, we don't have any product at all in New Jersey. New York, sorry, New York.
And then I guess the last question is: once contracted, are we eligible to sell in any state?
I'm sorry. Say that question one more time. I'm sorry.
Once contracted, are we eligible to sell in any state?
Any state that you're licensed in, once contracted, you have access to all of our products that we have at GTL. So like when you saw earlier here, we don't just have home health care. We do have other things too. But if you look at we have a whole suite of products that are available to you guys that you can access. And as long as it's available in the state and you're licensed in a state, you're definitely more than welcome to offer any of our products.
All righty. I guess with that being said, thank you so much, Dimitri, for taking the time today to give us all this great information. I'm sure a lot of agents are going to take advantage of this. And again, thank you to everybody in this training as well for taking the time to sit through this presentation. Our phone number is going to be 1-800-772-6881. Extension 7722 will be my direct extension. If you guys want to get contacted, always feel free to reach out to anybody at Pinnacle.
Don't forget to subscribe to catch the latest news in insurance and agent training. See you in the next video.